Welcome to the first part of our work of breathing sessions. This session, we're going to be looking at what does it mean when we talk about breathlessness. This introductory session aims to introduce the theory of increased work of breathing and the terminology used. We'll look at how it is perceived by ourselves and by people who are suffering from respiratory disorders, and we'll also introduce some of the causes of increased work of breathing.
Okay, so before we start today's session, what I want you to do is I want you to think about breathlessness. Okay, so we all experience breathlessness every day or most days, but do we ever stop and think to quantify that experience and what's going on in your body? So let's have a think about it just now. Okay, what I want you to do first is I want you to grab a pen and some paper. Okay, and what I want you to write down are 3 headings. So breathing, heart, and general, like this. Okay. And now I want you to think, as you're sitting there being sedentary, how do you feel? Okay, so take a minute and count your respiratory rate, and then take your pulse. Okay, note how you feel. So how do you feel within yourself? How does your skin feel? How do you feel throughout your body in general? And lastly, I want you to think about your thoracic expansion. Okay, so remembering back to when we did assessment, popping your hands around your rib cage and feel your breath in and out. Okay, have you got all of that? Okay, so the next part, what I want you to do is to actually get breathless. Okay, so that could be climbing the stairs 10 times, it could be doing some burpees, it could be going for a run, whatever is going to make you breathless. Okay, like this. Now, look back at your headings. Okay, try and count your respiratory rate. You might find this quite difficult because you'll be recovering. Okay, if you have a heart rate device, look at your heart rate, look at your pulse, and compare it to before. Try your thoracic expansion again. How does that feel? Do you notice a difference from before? So are you breathing more or less? Okay, and generally, how do you feel now? Do you feel hotter, sweaty, anxious? How does being breathless make you feel? Okay, so write all of that down. Okay. The other thing that's important to write down is to write down what you did in order to make yourself feel like this. Okay, and this is a bit that's important for your patients. Okay, did you have to go and run 3 miles? Did you have to run up and down the stairs 20 times? Because when we're talking about our patients, it could be something as simple as going from sit to stand that elicits this response.
So this is how I felt after a 25-minute HIIT session. So my respiratory rate had increased from 12 to about 20. It's difficult to assess that because it comes down as you're recovering. When I looked at my thoracic expansion, it was decreased after exercise as opposed to before because I was working so hard to maintain my breathing. My heart rate was easier to monitor, so my resting heart rate before I started was about 60 and it increased to about a maximum of 140 during that. Okay, and I was aware of my heart beating as I was thinking about it. In general, as you could see from the photo, I was a bit more sweaty. I was hot as well. It increased the metabolic demand on the body, and I was more aware of my increased heart rate and my increased respiratory rate.
Okay, so now we've all experienced breathlessness, okay? Say this bit of paper as it provides your reflections on how breathlessness is for you, okay? Bear that in mind when on the next slide we're going to have some people talking about their experience of breathlessness and how it feels for them. Note how different this is from your experience of breathlessness, and then we're going to go on to discuss the different ways in which breathlessness can be described.
Poorly person, I think of myself as somebody who did cartwheels across beaches in golden sun.
I enjoyed dancing. Bopping then and jiving was a big part of my life.
I used to be a kind of clarinet playing, singing, swimming, dancing, drum playing. I used to swim about a mile a week, go to the gym 4 times a week, and I really struggle to do things now.
When you have a flare-up, you do feel ill. You don't know how you're going to get your next breath. It's an effort, everything you do. Your energy is sapped.
Every inhalation, every exhalation is a stroll. So that becomes your focus. It takes away all the enjoyment of anything else.
It just stops you doing a lot of things that you would like to do. My mother always says I couldn't walk upstairs until I was about 6.
Trying to go up the stairs, trying to walk up a little hill of about 10 yards.
Sort of struggling to catch my breath, and that panic, and that then triggers the breathing more and the anxiety more, and then that 50 kilo weight on your chest suddenly becomes 100 kilos and you can't actually sit up from it.
It does impact on relationships, makes it difficult for me to give the support I'd like to my children and grandchildren.
Whilst I have a good relationship with my breath, issues become sort of insurmountable at times.
We're in the midst of an asthma attack. It's as though you were trying to breathe through a straw and that you bent the straw back on itself, squashed the end, and you tried to breathe through that straw.
It's almost like trying to breathe through a wet sponge.
The breathlessness of lung disease is a bit like someone's come round the back of you and is giving you a very tight bear hug. You just feel as if someone's put a straitjacket on you or something like that. And that's why it becomes very frightening.
It's a scary, dark place, and I kind of think a lot of the time you hold that within.
We were taught that TB, you had to be ashamed of it, and it wasn't accepted. And so you ran with this shame for the rest of your life. People are still ignorant to the fact. They don't want to know. It's just an age thing. It serves them right. They smoked.
Even if they did smoke, why should they be any more blamed from their lifestyle than those with heart disease?
Well, yes, I started smoking in my early teens, 13 or 14. It was a good social thing. There were lots of other people smoking at the same time.
Your grandparents smoked, everybody smoked, but we were never told it was really bad for you. Even when I was in the hospital for 9 months, the staff smoked. It could be something different altogether, how it's developed. But people aren't really interested in that because it doesn't sound nice when you're coughing.
It's not very glam, is it? It's not very glam to have a hacking cough and sound like a set of bagpipes.
You wonder about the people who are isolated with their illnesses at home.
What I do remember is that feeling of isolation from the wider world, from me peers, me friends, busy out playing, and I was stuck at home.
I think it is invisible, and people actually say to me, "Oh, Jill, I haven't seen you for months." And I said, "Well, actually, I haven't been very well. I've been in hospital." "Oh, really? Didn't know about that." People outside really only see you at your best, at the better bit of you, because if you're not feeling well, you don't go.
You know, you can look all right, you can sound okay, but then just getting dressed in the morning, getting dried after a shower can make you quite breathless, and that's just really frustrating. Inside, there's a very active person who wants to get out, who's often quite thwarted by what's going on in my lungs.
When we talk about breathing, it is important to understand the differences in terminology. Work of breathing, breathlessness, shortness of breath, and dyspnea can be used interchangeably. However, there are a number of differences. Breathlessness is a normal sensation for humans, and we have all experienced breathlessness at some point. However, this breathlessness is not troublesome and returns to normal after a period of time. For our patients, however, this sensation can take a long time to settle and can be very distressing. Dyspnea. Dyspnea is where breathlessness does not correlate to the effort. For example, a person may become short of breath when they're carrying out a simple sit-to-stand task. You, however, if you were to carry this out, would not expect to have any increased shortness of breath. Shortness of breath is both what we say, so you say that you feel short of breath, and something we can see. So you can see someone's work of breathing has increased and that the respiratory rate has increased. An increased work of breathing is a disturbance in the normal breathing pattern. This can be at rest or on activity.
As you can see, there are many domains when it comes to breathlessness. Breathlessness is a subjective experience. As such, it can be hard for healthcare professionals to fully understand what it means to their patients. Patients do not always associate it with their illness, and sometimes they can think of it as just a part of getting older. As clinicians, yes, we have experienced being shortness of breath and breathlessness, but it is controlled by us and it is time limited. Imagine feeling as you did earlier, but all you have done is get out of bed. The public has a poor understanding of people who are short of breath as well. Patients adapt, so they do not get out of breath in public, or they will avoid certain activities.
Now let's look a little at the differences between breathlessness and dyspnea. Breathlessness is not an unpleasant symptom. It should be one that is not bothersome, and the symptoms of breathlessness are that you feel like you're breathing hard, there is a sense that you're exerting yourself, you may be puffing, but these sensations do not bother you. However, dyspnea is unpleasant and feels like it is hard work. The patient may experience chest pain and that they cannot catch their breath. This is a very frightening experience. What you see as a clinician is that the patient has shortness of breath. You may notice an increase in the respiratory rate, an increase in the depth of which they're breathing at, a change in their posture, an increased use of accessory muscles, and a change in their colour.
Breathlessness is a symptom that occurs in over 94% of people with chronic lung disease, more than 78% with lung cancer, and 50% with heart disease within their last year of life. The cause of increased work of breathing can be respiratory in nature, so this could be related to pathology such as COPD or pulmonary fibrosis. It could be cardiac, if they've got left ventricular dysfunction. Metabolic, so for example, if someone's got a high fever and there's an increased metabolic demand, there'll be a bigger demand on oxygen and therefore a bigger an increased work of breathing. It could be neurological, so particularly if the diaphragm is affected, so in diseases such as neuromuscular disease, which can affect the power of the diaphragm. Psychologically, there could be things that would affect breathing, so things such as anxiety, and there's another topic on the psychological aspects of breathlessness later. Pain is also an important factor, particularly if you're working in surgery. If someone's in a lot of pain, it can cause an increased work of breathing.